So today I want to discuss with you the potential liability on the part of a certified nurse midwife when a baby has a traumatic brain injury at birth. The reason why I want to talk with you about this today is because in talking to some families who are dealing with these type of HIE injuries for their child, when we get into the interview and when we're talking about everything, it's not a shock to hear, or it's not out of the ordinary to hear mothers or parents or families to say, well, I had a midwife and I thought that meant that everything was going to go well, that I was not going to have any problems, because it's my understanding that midwives are supposed to be better and things like that. And first of all, I want to say this: you have good and bad in all professions. You have good lawyers and you have bad lawyers. You have good doctors, you have bad doctors. You have good CPAs, bad CPAs. Good teachers, bad teachers. So you can't look at it that way. You have to take the individual as they come, and you have to do your research and try to find out as much information as you can about the person that you want to hire to perform a professional service for you. So I want to get that out of the way. Number two, when I'm talking about a certified nurse midwife in this context, I'm also talking about a nurse that also has RN training. They have registered nurse training, and they have training, specific education and background training in labor and delivery. Each state may have specific rules when it comes to midwives, so I'm not going to get too deep into that because it's going to depend on state to state. But the reason why I want to talk about this is because when we are dealing with certified nurse midwives, they have their own, and they have that RN, they have other training. They have their own training that will mean that they have to follow the standard of care. So they will have a standard of care that they are supposed to be familiar with. So for example, if that certified nurse midwife is looking at fetal heart monitoring strips, then they have to follow the standard of care when they are reading the strips. They have to understand what is minimal variability. They have to understand late deceleration patterns. They have to understand bradycardia, tachycardia. They have to understand uterine contraction. They have to understand all of these things. And so if you have, for example, let's say that you have a fetal heart strip that is going, and the midwife is in there, and the midwife is taking a look at everything, and let's say we have prolonged decelerations, let's say we have not minimal, but absent variability, let's say that there's some bradycardia going on, there's some problem with mom's contractions. All of these things mean something. And these midwives, these certified nurse midwives, they are supposed to understand what these things mean, and they are supposed to take appropriate action based on what they are seeing and what's going on with mom and baby. Where problems can occur is when these certified nurse midwives, when they do not follow the standard of care, they deviate or they violate the standard of care, and that deviation is what causes or goes on to cause the baby's injury, which is in this context is going to be an HIE injury. So when it comes to certified nurse midwives, that yes, they can have potential liability. They can have issues that come up. And as a matter of fact, I have sued a number of certified nurse midwives or midwives that have been involved in the care and treatment of babies. So I say all that to say that just because you have a midwife, that does not necessarily mean that everything is always going to go right. You need to make sure that you do your homework and find out as much information to find out if this midwife, this certified nurse midwife, is going to be the best fit for you and your family. If you have more questions, maybe you're watching this video today because your baby has suffered an HIE injury, a traumatic brain injury, hypoxic ischemic encephalopathy, and you have questions as to what caused it. Was it something that your certified nurse midwife, was it something that they did that caused the injury or the harm? Or was it something genetic or developmental? If you have all that going on, what I invite you to do is go ahead and get your phone, get your cell, and give me a call. There's a telephone number down below on the screen. And I talk with families like yours all the time about these issues. When you contact my office and you talk to my secretary, just make sure that you get on our calendar, you pick a good date and a time to be able to talk with us about your baby story. In addition to that, you want to make sure that you provide a good email address. Sometimes we have to reach out and talk with you on email, or we have to send you a message on email, and we need to make sure that this is an email account that you check frequently. One more thing before I get out of here. I practice law here in the state of Maryland, and I know from time to time I have individuals who will contact me in my office, but they are not in Maryland. They're in the United States, but they're not in Maryland. And I just want to make sure if that is you, that you understand that we have to use what we call co-counsel or local counsel. In other words, an attorney in your state. And that's something that we can look to work, to help you with. But I just want to make sure that you understand that co-counsel or local counsel aspect of things if you are not here in the state of Maryland. All right, that's going to be it for today's quick educational video. Again, I'm Marcus Boston, and I'm one of the childbirth injury and medical malpractice attorneys practicing law here in the state of Maryland at Boston Law Group, LLC. Talk with you next time. Take care. Enjoy the rest of your day.